Leadership TV for God and country.
Good day, viewers, and welcome to another edition of Health and Wellness on Leadership Television. My name is Winifred Uglebo with my co-presenter.
I'm Patience today, Rebecca. Thank you, viewers, for being with us afternoon.
Yes, as you can see, we have our guest in the studio this afternoon, and he is a consultant obstetrician and gynecologist, Dr. Onouh. Thank you so much for your time. Thank you for this program. Yes, we are going to be talking about women. Our discussion today is focused on women, talking about fibroids. Fibroids. Many women today are battling with the issue of fibroids, and why so many have gone for operation to take it out. So as you have it, that's a nagging issue. It's all about women on today's episode of the program. Welcome once again.
Thank you very much.
Now, doctor, let's start with what is the cause of the fibroids? Or is something that many doctors say they are not really sure of. How?
Well, I think that first start by saying what uterine fibroids are. Uterine fibroids are benign growth in the uterus. The uterus is the womb, and the womb is that unique organ that is specific only to women because its function is basically to carry pregnancy. Now, the cells of the womb are made up of what we call smooth muscle, and for reasons that we don't know, haven't yet pinpointed, one of those cells just begins to grow abnormally and begins to have an appearance that is different from the other smooth muscle cells in the womb, and it begins to grow like that. It can be type that grows to be very big, just a single big one, or it could be small and then just numerous of number in terms of the number, just numerous in number. We don't know what causes that growth. The good thing is that they are not very often cancerous. The chance that any of these things become cancer is usually less than 1%. But so it's usually just a benign, meaning that it's not malignant. We don't know what causes it, but we know that it is more in African women than in white women. We also know that when African people travel abroad and begin to live abroad, the so-called African Americans, they also have a higher occurrence of fibroid than the white population. However, the incidence for them is lower than the incidence we find among Africans that are in Africa. So that makes us to think that there's probably something about our diet that affects the occurrence of fibroid. We also know that it is something that can occur in families. So if you have a sister that has fibroid, the tendency is that yes, that the other person could also have fibroid. Yeah, so when the woman enters menopause, again, it's tricky the symptoms, in terms of symptomatology, the incidence of symptoms becomes a lot reduced. However, the sheer presence of fibroid does not change because it most likely would have been there before she got into menopause. But the symptoms will reduce definitely. You will not find people in menopause complaining a lot about the symptoms of fibroid. But if you just take them and then let's just check their womb if it's there, you may still find the fibroid there. But the incidence of the symptoms seems to reduce once you get into menopause.
Now, I want to find out from you, somebody, a woman that has fibroid, how does it present?
Well, very important question. The commonest presentation of fibroid in our environment is no symptoms.
No symptoms.
No symptoms.
How is that
50% of women will have with fibroid will have no symptoms, which means that the diagnosis will be an incidental diagnosis. Either this diagnosis is made when you are doing an examination and find out that the uterus is enlarged, and then you send the woman for a scan, and then the scan will pick the fibroid. So you will find out that in a large number. In fact, it's an interesting study that they did. So they did an autopsy amongst a large population of women who did not have any complaints of anything, and found that about 50% of them who had no complaints of fibroid had fibroids when you did the autopsy. So that's the commonest presentation, no symptoms at all. After that, you now begin to have those that have symptoms. Those are actually the ones that are coming with complications. Now, you see that the fibroid becomes so large that it now begins to exert pressure on the surrounding places. So the woman will come with those symptoms. So you see that she's having problem with constipation because the fibroid is pressing on the intestine, or she's having problem with urinating too frequently, having urinary tract infection because the pressure of the fibroid is on the uterus. It could also come with pain because the sheer presence of the pressure of the fibroid in the pelvic place will cause discomfort. So she may have pain that is either related to menses or not related to menses. When the pain is related to menses, we call it dysmenorrhea. If it's not related to menses, we just call it pelvic pain. So pain can be another thing. Then the woman will come with different kinds of abnormal bleeding. It's either she says that the bleeding is too heavy, or the bleeding is irregular, or there's bleeding in between bleeding. Meaning, this is the time I'm supposed to see my period, and in between that time, I now have abnormal bleeding. That's a common thing, which can also be complicated by the woman coming down with very low blood level, what we call anemia, and all the problems that can come with anemia. Those can also present, you know. Now, there are some other symptoms that women with fibroids can have. You can have women with fibroids coming down with recurrent miscarriages, right? And you can have women with fibroid having difficulty getting pregnant, right? So these are the several ways in which fibroid will present. I've actually had some unusual presentations where women with fibroid look as if they have cancer. This is an atypical presentation of fibroid. And amongst them, you can also find some of them that we call it the pseudomex syndrome. The woman looks as if she has cancer. The stomach is so big with a lot of fluid in the stomach. She begins to lose a lot of weight, and you think that, oh, this woman has cancer. But then it's just fibroid. It's just fibroid. It's not a cancer. It's just a benign fibroid. So you can have that. We call those ones unusual presentation. The woman can also be coming down with what we call hypoglycemia, like her blood sugar is just coming very low, and it's because of the fibroid mass. But again, these are not the common presentations. The common ones will be that the woman has very abnormal uterine bleeding. She has a very uncosmetic, very polycosmetic enlarging womb. Usually that's what will alarm them. Are you pregnant? And say, are you pregnant? Are you pregnant? And she's not pregnant.
Yeah. Well, that is usually the case we see, because we see some women
Yes.
with big stomach, and And but as a matter of fact, doctor, I also made a mistake once. I saw a sister in church, and I was like, "Oh, congratulations, this is sister. Of course, you'll be married." And then I was like, "For what?" And of course, I was taken aback. He said,
You're
"You're
pregnant,
She
I guess.
was like, "No." And I felt so embarrassed. I think I embarrassed her. That is why most times I feel that it's not too good to jump into conclusion. But it was so evident because of her stomach big.
Yeah.
So I just assumed.
So that will be the reason that woman now would now say, "Oh, let me go and see the doctor," because the woman is most likely having no symptoms at all. Or for some of them that have heavy menses, they think that this is normal, that these heavy menses they are having is normal. and they will not often seek any help. And then some
And
of
I
them are
also,
just
I was,
scared and
don't,
won't
I
come.
was also in that kind of, not me anyway per se, but I had a friend, and because I reported head over the years, so I could actually relate to some of these illnesses. So she has heavy menstruation, and I said, no, I go and check. You have, he said, no, God forbid, she was
Yeah,
rejecting. I don't know because doctors say most times, and of course, and eventually she went to the hospital
and it's fibroid.
and
Yeah, I think that fibroid comes first into mind when you have a black woman of African descent
Mm,
who is um, not has not been pregnant,
okay.
right? So
The womb is just
the
there.
womb is empty, has not been used for the primary purpose of childbearing. So that is the typical demography of uterine fibroid. Non-reproduced women, Africa, with a family history of fibroid. There is a maxim we say good girls get fibroid, bad girls get cervical cancer.
Actually, it's really interesting, doctor,
Okay,
because you are
doctor,
going to be
sorry.
sharing more. Okay, no, you
Okay,
can go ahead.
for a woman that knows of cancer, fibroid, at what stage do you advise the woman to do for operation?
Operation.
Or operation is the only way to.
Well, surgery is not the only treatment option for women with fibroid.
Really?
Yes, we would categorize the treatment option for fibroid into women who still want to use that uterus. So women who want to maintain their reproductive, their fertility, their ability to carry children, and those who no longer have any need to um, retain that reproductive potential. So the treatment for these two categories will be different. Now, there is something notorious about uterine fibroid, and that is recurrence. So,
Yes, I was even going to ask you. I just wanted you to finish on this. I didn't want to interrupt because I've seen cases whereby some ladies I know they went for
fibroid operation, and
and it
then it
still
came
came
back.
back.
Yes.
Yes.
In fact,
Why is that so?
it is notoriously recurrent. As I said, we don't know what causes it.
Mm.
So, when you just go there and remove the one that you have seen,
Mm.
there are probably very tiny ones that are in evolution. They are not yet big that you might miss. And then those ones now, will now come up. The young shall grow. And then they now, with time, will also grow. And you can have scenarios where the fibroid has been basically the fibroid has been removed. There is a different kind of fibroid, and again, there are different ways you can find fibroid in terms of their location and size and all of those things. And you can have another one from some other place developing. Because we don't know what causes it, it becomes difficult to say, okay, if you do this, you will stop it, but you don't. And that is why for women who do not have any need to use their uterus, the best way to deal with fibroid and know that this matter has ended is to remove the womb. That's what we call hysterectomy. You can do that through an open surgery or through what we call a laparoscopic surgery or a laparoscopically assisted vaginal procedure or a vaginal procedure. So, in other words, I can cut her open, remove the womb. I can pass a little camera through her umbilicus that allows me to remove the womb, or I can go through the vagina and remove the womb without having any cuts. So that is the method that if you do that, you are certain that you have sorted out the issue of fibroid with that woman is not going to occur again. However, if the woman is not ready for that, then you have to manage the symptoms. So there are women that okay, don't remove the fibroid, but just manage the issues I'm having with the fibroid. So there is that management. You just manage the issue. There's pain, I manage the pain. There's heavy bleeding, I manage the heavy bleeding. So it means I can use drugs to manage the heavy bleeding. I can use drugs to manage the pain. Then there are those that you now say, you know what? This fibroid is obstructing this woman's ability to carry pregnancy. And she wants to carry pregnancy. She wants to retain her fertility. Can I remove this fibroid and just repair the womb back so that she can carry pregnancy? That is the more popular surgery in our environment. We call that a myomectomy. So we go there and just remove the fibroid. And I think I need to say it first. I was going to say that I thought about it when I was coming here. The term fibroid is actually a nickname. It's not the real name. It's just like how when your nickname became so popular, people forgot your real name. The real name of fibroids is leiomyoma or myoma, right?
Scientific name.
That's the proper name. And that's why the remover is now called myomectomy.
Okay.
All right. So we are just going there to remove the fibroid and then you repair the wound. And the woman can carry pregnancy. However, you must let her know that there is a possibility of a recurrence or a regrowth of the fibroid. So, how can we remove the fibroid through myomectomy? We can again do an open procedure where we cut her open. She has a big scar, we go and remove the fibroid. We can go in with a tiny hole in the umbilical, put a little camera, put some tiny, tiny cameras in there and remove it so that when you look at the woman, there's no scar, no obvious big scar in there. We call that laparoscopic myomectomy. Then sometimes you find the uterus, the fibroid is just in the inner lining of the uterus. It's not in the outside, just in the inner lining. Then you can take a camera and go through the vagina, go in there and just take out the fibroid from the inside. We call that hysteroscopic myomectomy. These are all available in Abuja and have now. What determines which of the myomectomy you can do? The size. The size and location of the fibroid will determine which of the procedures you can do. In the interim, we can manage with drugs that can reduce blood loss, tranexamic acid, combined contraceptive pills. Those things just help reduce the blood you lose during the period while you decide whether one, you want to have the myomectomy later, or you want to have the womb removed completely, or you want to wait until you enter menopause when the fibroid will stop growing. So for women who are close to menopause, you can just decide that, okay, you know what, I'm going to just buy time until she enters menopause when the fibroid will stop growing. And you can also use some other drugs. And you have to say there's a drug that can shrink fibroid. That's important for me to say. I get that a lot. Doctor, there's this drug that can shrink fibroid. Yes, there are drugs that can reduce the size of fibroid drastically. But you must ask yourself, if I'm reducing the size, to what end? Because once you stop those drugs, the fibroid will return to the original size it was before it started getting bigger. So it's either you say, I'm trying to reduce the size of the fibroid until she enters menopause, or I'm going to reduce the size of the fibroid so I can, instead of doing an open surgery for her, I can now do that laparoscopy, that minimal surgery, so I don't need to give her a big cut. All right, but to just reduce the size of the fibroid and then stop the drug to go back to square one, and then when you now go to remove the to remove the fibroid later, you will now have a hard time because fibroids have this particular characteristic that it's easy to differentiate them from the normal tissue. But once you take those drugs, their boundaries now become so blurred that it becomes difficult for the surgeon to be able to remove them. That drug is what we call GnRH analogs. All right, but whenever you want to say you want to shrink the fibroid, you must be able to tell why am I shrinking it? What purpose am I doing so I can now do a myomectomy later? Am I doing so I can enter menopause? I don't need to do surgery at all. And yes, that. Now there are some very recent and advanced ways we can deal with fibroid now without requiring surgery. But for these cases, they are usually retained for women who no longer want to use their own pelvic. So there's something we call the uterine artery embolization. So a radiologist will be able to go to your femoral artery, connect it to the artery that's supplying the uterus, and release some things inside there. It will stop the blood flow to the uterus, and the time the uterus now begins to shrink and shrink, and of course the fibroid is involved and it's also shrinking without you cutting the woman. Then you can do what they can
And
get.
the woman can still make use of the womb.
No, we tend to leave it for women who no longer want to use the womb because there is a possible complication of the entire uterus going under necrosis. The entire uterus will just necrose. So if it's someone who wants to use the womb, you don't want to do that for the person. Then you can do what we call endometrial ablation. So what we do, they go into the inner lining of the womb with something, and we cut off just we just ablate it. Ablate means like to burn it with a special thing, so that for women who are having heavy bleeding from medicine, the bleeding will now become reduced. Then there's this high intensity focused ultrasound that we can use to just focus it on the fibroid using MRI to guide them and then fire this high ultrasound waves into the fibroid and then it will just guide speed.
Is it high flow?
High intensity
There's one for
ultrasound.
high flow.
Yes, high intensity frequency ultrasound. That is also available. But as I said, because the data, we're still gathering data about these very new and novel things, we tend to say, let's reserve this thing for people who no longer want to use the womb. Yeah, we don't do this thing and now find out that, sorry, madam, your womb has been just that this procedure.
Yes,
Right? And no
really.
man has. So we retain this new procedures for women who no longer want to have any reproductive desire.
No, doctor, for a woman now that wants to take in, that wants to have children, and she has fibroid, what should be done? What ought to be done for her?
Yes. So as I said, the first thing I said was that the common symptom of fibroid is no symptom.
Mm.
So the presence of fibroid does not always mean that the fibroid is the reason the woman is not conceiving. Right? I have had cause to deliver women with very huge fibroid. In fact, there's a very remarkable one about one of the nurses where I used to work, and she delivered. Her baby was 2.9 kg. The fibroid was so huge, we had to remove it by surgery, and the fibroid was also 2.5 kg. So the fibroid I'm dealing with is the same weight, right? So women with fibroid can get pregnant. So if I just see fibroid in a woman, and the fibroid is not distorting the womb, the fibroid is not affecting the inner lining of the womb, the fibroid has not made the uterus to be so large, I'm not quick to think that the fibroid is the cause of the woman's inability to conceive. So you have to still go through the primary investigation for infertility, find out whether there are other causes why this woman is not conceiving. Now, the problem is, if there are no other causes and you have tried all you can and the fibroid is still there, then you will now have to say, well, maybe this fibroid should go. Let us know whether you are the one causing the problem or not. So I think that what needs to be emphasized that the mere presence of fibroid does not mean you have to have it removed. Some patients come and then they say, I did a scan, they say they saw a fibroid. The fibroid is 1 by 1 millimeters in size. Doctor, what do we do about it? And I say, don't do anything. Doctor, no. See the scan. I say, don't do anything. Is the fibroid disturbing you? No. If it's not disturbing you, don't disturb it. Right? Now, that is the first thing. If there's no need for treatment, there is no need for treatment. But then, when do you need to treat? If the fibroid has a huge size, you need to treat. If the fibroid is causing huge blood loss and the woman is losing blood, there was a woman my friend told me about, and she was in the market and she started bleeding, and it was just embarrassing. There was a lot of blood and she was feeling dizzy and almost fell down. They had to hold that fibroid obviously, even if it's 1 by 1 millimeter and it's causing that much blood loss, should be removed. If the woman has been trying to conceive and we have done everything and the fibroid is distorting the womb and the fibroid is increasing the inner lining of the womb, what we call a submucous fibroid, then fibroid should be removed. If the woman feels that I'm a fine girl now, why is my tummy big like this? How bad? This is spoiling my market. Doctor, I don't like this big tummy. Then the fibroid should be removed for a cosmetic reason. That's fibroid should be removed. If she's having pressure symptoms, sometimes the fibroid can put pressure on the side wall. And the side walls, you have pipes, what we call the ureters. They have pipes that carry urine from the kidney to the bladder. We can put pressure, and then the fluid from the kidneys are not able to flow freely to the bladder. So they begin to have back pressure to the kidney and begin to damage the kidney. What we call hydroureter, we call an obstructive uropathy. It's obstructing the flow of urine and begins to damage the urine. That is enough reason for us to remove that fiber so that we save the kidneys.
No, doctor, no, we are running out of time. But I just want to ask this. This surgery, how risky it is? Because we've been hearing stories of, maybe in the past anyway, of people who undergo just fibroid operation and they die in the process. How true is it?
I think that it is very important to state that Fibroid is a high risk surgery.
It is.
It's a high risk surgery. It is the reason why you should not submit yourself to that operation if the person does not have the requisite qualification skill, because there is a need to assess the risk that the patient is predisposed to when you are going to do this surgery and help to minimize that risk. If you are going for fibroid operation, there is a risk of blood loss. The myomectomy is a very high blood losing procedure, and if the woman has a low blood level and you do not do what is necessary to correct pre-operation and post-operation, she's at risk of losing a lot of blood and dying from that process. You can damage surrounding structures. The womb has grown out of its original site into the site of the abdomen, where the bladder is, where the intestine is. Sometimes it will now join body with those things. And then if you do not know what you are doing, you end up damaging those things because you are trying to remove fibroid. So there's need for that. There's also need to know that that can happen. There's also need to know that if you cut this big uterus and refashion it, you have compromised his blood supply. There is a possibility that if you do not know what you are doing, you can over-compromise the blood supply, that the whole womb itself will gangrene or rotten, right? And can also get infection, right? So all of these things does not mean that, oh, I will be afraid of going to do the surgery. No, it just means that if I'm going to submit myself to this surgery, I must be sure that the person that is doing the surgery is qualified to do it. He has experience to do it, right? And he has taken the requisite, precautions to make sure that my procedure is safe. There are times that we want to do surgery for patients, especially patients that have previous surgery, that as a gynecologist, which is fibroid happens to be my primary field, I will still say, you know what, I need to call a urologist. Urologist is the person who does kidney and all of those things. He will have to come and join me for the surgery. Especially for a woman that has a fibroid that is so huge and is already affecting that her kidney. That person has to join me in that surgery. Or I have to call somebody that is going to help me because this woman's fibroid has joined with her bladder, has joined with the intestine, and another consultant has to come and join. Now, if you don't have somebody that knows that this is what needs to be done, it increases the risk that you face if you go out. So it is not particularly a minor procedure, but it is relatively safe where you have the right professional who is taking the right precautions.
Thank you so much. Now, just a quick one before we go, doctor. If somebody wants to undergo, what is the estimated cost?
Again, that is a very, very. I have to give a diplomatic answer. You know that if you want to buy rice in Mama Put, it is the same rice. It may even be sweeter. You buy it at 500 naira. If you go to Mr. Biggs, the same rice is 1.5. If you now go to Transcorp Hilton, that's your same rice. It may not even be as sweet as Mama Put's own, will now be 50,000 naira. So I think that the cost of surgery depends on where you are doing it. In private institutions, it might be slightly more expensive than government-owned procedure because government subsidizes everything for everybody. But I always tell people that when you want to, for instance, repair your car, you find a good mechanic because you are worried that the very time you're trying to kill you, you don't consider what will they charge, right? You consider that this person will not kill you. So if you are going for surgery, also consider that if I save this 100,000 naira by going to this guy in this village in Maraba or this thing that say you do this thing and you die, or you have a severe complication that they cannot manage and they now bring you this thing, that money,
you'll be scarred for life.
That money will not, you will not be around to make the money anymore. So I don't think that healthcare is expensive. Sadly, the issue around should not be what's the cost of myomectomy, but how do we finance healthcare for our people? If we are going to be cutting corner because of cost, we are going to end up cutting the quality of care people will get. So we should be talking about health financing for our people. But if you compare fibroid surgery in Nigeria and abroad, I can boldly tell you that it's cheaper here. Very cheap here when you compare to what you spend doing the surgery outside Nigeria.
Thank you so much.
Thank you.
Thank you so much, Doctor.
Okay, yes, our time is up now, so it's time to go. Well, viewers, this is where we call it today of today's program. It's been so much, it's been an interesting time with our consultant obstetrician and gynecologist, Dr. Onouh Monday of Boston. Dr. Monday, Dr. Onouh, I look forward to seeing you same time because you just share so much bright lights on fibroid. And of course, you're also going to be taking us on what can be done with healthcare financing. Because as you pointed out, many people are still paying for healthcare from their pockets and of pocket expenditure. So we look forward to seeing you more on the program.
Really nice.
So we are same time, same station is another day on the program. Patients, you have something to say.
Thank you, viewers,
As
for
you
joining us
know.
today. Same time, next week we'll be back here.
Okay. See you. Bye.
Be part of our brand. Leadership for God and country.